Hello and welcome to the next episode of the Explain series with your host, Dr. Bret Palmer. In the Explain series we take a sexual health topic and explain it, and this week it's HIV. So what does HIV stand for? HIV means the human immunodeficiency virus. It's a virus that lives in your blood, but it can also be in semen, vaginal excretions and anal excretions as well as breast milk. HIV is usually transferred through sex, to mother and child, through birth or breastfeeding, and also through IV drug use. In order to prevent HIV, there are a number of ways. One is to use condoms, but if you know your partner has HIV, one way of preventing it is for them to be on treatment and to have an undetectable viral load. And if their viral load remains undetectable for longer than 6 months, then undetectable equals untransmissible. For mothers who are pregnant, they can reduce transmission to their child by being on therapy and ideally having a cesarean and not breastfeeding. But your obstetrics team and HIV team will be able to advise you further on that one. In terms of what happens if you just leave HIV all alone, well, let's go through the journey of what happens when someone catches HIV. You may not know that you've actually caught it, and a lot of people have absolutely no symptoms at all. But for some people, they may have flu-like symptoms for around about 2 to 6 weeks after they've been infected. They may also have a rash, headaches, and various other flu-like type symptoms. After this, they may be very well for a long number of years. But as the time goes on, as the weeks turn to months and the months turn to years, what HIV is doing is infecting the white blood cells. And as each white blood cell is infected, more virons are spread and infect other white blood cells. And this eventually disables the immune system. After a time, when the immune system gets more and more disabled and has an inability to work, this eventually turns into something called AIDS, which is acquired immunodeficiency syndrome. Nowadays, this is called symptomatic HIV. And all it means is once your white blood cells fall below a certain level, your body is unable to fight infectious diseases and some types of cancers. And so these become AIDS-defining illnesses. All this, remember, is completely preventable, because if you're tested for HIV and you are positive, then you can go on to treatment. Treatment tends to be 3 types of antiretroviral drug. Some people may be on 4 and some people may on 2, but usually you're started on 3 drugs. And the whole idea of treatment is to make sure that your virus is suppressed to undetectable levels, because after 6 months, undetectable means untransmissible, which means you can't pass it on to anyone else. Treatment strategies obviously vary, but the simple idea is to keep you undetectable for the rest of your life, and treatment unfortunately is lifelong, as there are no cures at the moment. So how do you diagnose it? Well, diagnosis is very simple. You just go to your local sexual health centre and they'll test you. Usually testing can be done by various methods, sometimes a finger prick test in usually the bigger clinics, usually in the city. Otherwise, it's usually a blood test from the arm. And what they usually test is for either antibodies to HIV. You will have to be aware of the window periods for certain types of test. Now, if it's a very good 4th generation test, the window period is 4 weeks long. That means from the time you've been exposed to a particular infection to the time it shows up in a blood test can take up to 4 weeks for around about 98 to 99% of people to form antibodies. And so if you've had a particular infection, had a particular exposure 1 week ago, you may want to get retested in, say, 3 weeks' time. There are some tests, though, and especially point-of-care tests, where the window period is actually 3 months. while most people would have actually seroconverted, in other words, made antibodies to HIV within the first 4 weeks, there are some people that don't make certain antibodies up until 3 months. So it's very important to make sure that the doctor you're speaking to or the nurse informs you about the window period of the test you're receiving. Either way, HIV is a very treatable disease and it's nothing to be afraid of. Unfortunately, there are a lot of people that do stigmatise people with HIV, and this is something that we are currently trying to combat. And depending on the culture you come from and the society you live, will depend on how people view HIV. Either way, you can get lots of help from your sexual health centre, and they can point you to HIV support groups if it turns out that your test is positive. If you're wondering, should you actually test for HIV, then I would strongly recommend that you watch the video a few weeks beforehand on HIV, why test? Obviously, there's lots of people out there who don't have HIV and want to prevent it, and so there are many different ways. For the vast majority of people, condoms. Just rubber up, that's the best thing to do. There are other types of prevention you can do. One is to take something called PrEP, which is pre-exposure prophylaxis. There will be a new video on PrEP over the coming weeks, but in short, what PrEP is you take a particular tablet, and at the moment, at the time of filming, there's only one available, and that tablet's called Truvada. That contains 2 antiretrovirals. You take this tablet a few days before you have sex, and then if the condom breaks or there was no condom used, then that should prevent HIV transmission to you. But one thing that's very important is PrEP doesn't prevent any other sexually transmitted infections, and so ideally you should probably still use condoms. Another form of prevention is if you were using the condoms but weren't using PrEP and the condom broke, then you can use something called PEP. That's post-exposure prophylaxis. Post-exposure prophylaxis is available in most sexual health centres and can also be available at your local emergency department as well. Post-exposure prophylaxis is 28 days worth of treatment using a few tablets. One of the tablets is called Truvada, as the same tablet used in PrEP, and the other tablet is called Raltegravir, where you take either 1 tablet in the morning and 1 tablet in the evening, and that's each tablet is usually of a dose of 400 milligrams, but if you're lucky enough to get the higher dose of 600 milligrams, you can take both tablets at the same time as you take the Truvada. A course of PEP is for 28 days long. If you're an individual that's taken PEP once or even twice, then you may want to consider getting PrEP. How you get PrEP, you may ask? Well, ask at your local sexual health centre. There's a trial in the UK going on, and there may be spaces, so see if you can get on it. If, however, you want to get it privately, then I suggest you go to iwantprepnow.com or look on the website to www.ibase.info. If, however, you're watching this and you live in France or the USA or Austria and many other countries around the world, then your government will give out PrEP automatically as part of their sexual health prevention programme. Either way, if you want to get further information regarding HIV, there are a number of different websites. The first is the NHS Choices website, which gives a very good overview of HIV. The next is the CDC website and also AIDSmap info. Well, that's it for today. I hope you enjoyed this episode. Please like, subscribe and share. And if you like this episode, there will be another one coming next week. Thank you very much and have great sexual health. Take care.